Hello, I'm Dr. Rhonda Johnson. Today is Saturday, April 12th, 2025. Well, I'm a day late, but yesterday was World Parkinson's Day. So I'm talking about Parkinson's disease as a disease that affects the brain. And it doesn't just affect movement. It can cause tremors, slow movement, muscle rigidity, trouble with balance, and impact sleep, mental health, and memory. Now, people of all ethnicities and cultures can develop Parkinson's disease. Now, while it most often occurs in older people, younger people too can be affected, and men are more likely than women to develop the disease. The exact cause of Parkinson's is unknown, but there are several known risk factors, which include age. The risk increases as we get older. If you have a positive family history, and environmental exposure such as pesticides, air pollutions, and solvents can increase the risk, as well as a history of head trauma. Now, there is certainly currently no cure, but medications like levodopa and carbidopa and therapies such as physical therapy can significantly improve symptoms and help people live more fuller, active lives. Now, as of 2019, there were 8.5 million people worldwide who were living with Parkinson's disease, and those numbers are rising. Now, Parkinson's just doesn't affect individuals, it impacts the entire family because people living with the disease often rely heavily on family caregivers who often provide daily care under significant physical, emotional, and financial strain. So early recognition, access to treatment, and support for caregivers are essential to improving outcomes. Yet many people around the world still face barriers. They have limited access to services, there's stigma, and there's discrimination. But we have to also talk about research because progress depends on science. Without strong investment in research, there will be no cure. Now, right now, the proposed cuts and staffing and services for the National Institutes of Health really threaten critical Parkinson's research, including studies on prevention, treatment, and brain health. So, folks, if we want a future without Parkinson's, we must hold our elected officials accountable for full funding of the National Institutes of Health and other scientific institutions that are working to find cures and treatment and prevention for all types of diseases. That's my message today. Take care, folks, and be well.